Victoria's health system is facing another setback, which could see it lose $1.4 billion in federal funding. Despite the cash slash, the state government says it will invest up to $295 million to expand Dandenong Hospital's emergency department if re-elected in November.
Inside what will be the country's first dedicated heart hospital, Victorian Premier Daniel Andrews announced upgrades to another medical facility.
We will invest up to $295 million at the Dandenong Hospital.
2 new floors will be built to increase its intensive care and outpatient capacity. Premier Daniel Andrews says the investment will help the health system meet demand.
What it means is some 12,000 extra patients each and every year being able to get care at the Dandenong Hospital Emergency Department. There's 750 construction jobs in that important project as well. It'll begin next year and it'll be concluded as quickly as possible. We think around 2026, perhaps a little bit longer, just depends on final design and final detail, but it is exactly the right step to take.
As part of his plan, Mr Guy has announced an elected coalition government would spend $1.5 billion investing in roads he says desperately need upgrades.
Driving from Thornhill Park to Cobblebank, the road is an absolute disgrace. Even my kids commenting on the potholes on the roads.
$700 million would go towards upgrading the Western Highway to urban freeway standards between the Western Ring Road and Melton. Budget papers reveal that the federal government will cut around $1.4 billion of funding to Victoria's public hospital system over the next 4 years. While Premier Daniel Andrews says no amount of funding is ever enough, he does believe conversations with Prime Minister Anthony Albanese will be more fruitful than with the previous federal government.
Scott Morrison had indicated that this funding would end months and months and months ago. The Albanese government extended it out until the end of the calendar year. And we covered that at the time. I talked to you guys about it then, and we were very grateful. And on that day, and again today, we indicate that 50-50 is what should be the ongoing arrangement. But those arrangements are not due for renegotiation until 2025. In the meantime, we're pushing as hard as we can and working constructively on some really significant improvements to our Medicare system.
The opposition says it's just another setback the struggling system doesn't need.
Makes it harder when the federal government ripped $1.5 billion out of Victoria's health system. It makes it harder when the Labor government ripped $2 billion out of our health system. It means that an incoming government that I lead has to reprioritise money from the suburban rail loop and put it all into health, because that's where it's needed the most.
The state election is less than 30 days away. Health, public transport and renewable energy are shaping up to be focal points in the lead up to November 26. Holly Edwards-Smith for Sky News in Melbourne.